Chikungunya fever began to spread rapidly in July 2025 in Foshan, Guangdong. Recently, authorities in Beijing held a national meeting to launch a large-scale mosquito eradication campaign. Local authorities in Foshan have escalated epidemic prevention measures, reopening nucleic acid tests, which caused panic among the public. Scenes from several cities in Guangdong have resembled the extreme epidemic prevention measures seen during the early days of the COVID-19 outbreak. In cities like Guangzhou, Huizhou, and Zhongshan, intensive mosquito eradication efforts were mobilized, with thick smoke filling the air. Many netizens have posted videos sharing their experiences. On August 1st, a blogger who contracted chikungunya fever filmed a scene inside a hospital in Guangdong.
At the hospital, those with fever all gathered in a small room for tests. Testing for nucleic acids, dengue fever, and chikungunya. There's security guards watching over us, and we can't leave until the test results come back.
A Foshan netizen who tested positive for chikungunya fever shared a video saying they were forced to stay in the hospital without being allowed to leave. After testing for fever and blood, I was kept here for 7 hours until the results came out. Who decided on this policy? More than 100 people were stuck in a space, and since fever could be a virus carrier, who can guarantee that there are no mosquitoes here? If there's a virus source and a mosquito, what would the consequences be? Who's responsible for this decision? Another netizen posted a video saying that they had been in isolation for 4 days, with medical staff and guardians on 24-hour duty. The video showed security guards standing watch at the isolation site. In early July 2025, Foshan's Shunde district was the first to report a local outbreak of chikungunya fever, transmitted by Aedes mosquitoes. According to previous reports from the Guangdong Provincial CDC, as of July 29th, 12 cities in Guangdong had confirmed chikungunya cases, with Foshan reporting over 6,000 cases. The outbreak had already spread to Macau and Beijing by the end of July. On July 29, 2025, the Chinese Communist Party held a national teleconference in Beijing to discuss the prevention and control of the chikungunya fever outbreak. Official reports stated that the meeting emphasized preventing the spread of the epidemic and preventing imported cases, calling for effective mosquito control measures. However, the meeting did not reveal whether the epidemic had spread beyond Guangdong. Analysts believe that the emergency meeting suggests that the virus has likely spread to other areas, a typical move in such situations. On July 30th, the Foshan authorities announced that they had decided to activate a Level 3 public health emergency response. The official response levels are categorized into 4 grades, with Level 1 being the most severe and Level 4 being general. On July 31st, several residents of Lecong Town, Shunde District, Foshan, confirmed to the media that they had received notifications for 3-day nucleic acid test screening for chikungunya fever. Those with symptoms such as fever, rash, joint pain, or those who had been exposed to chikungunya patients or bitten by mosquitoes in the same area and time were urged to visit community health service stations or screening points for testing. On August 1st, a netizen posted a video of staying in quarantine in Foshan. They mentioned that after 5 days of isolation, they had tested negative and were discharged. The cost for the quarantine after medical insurance was 576 RMB, with the remaining costs paid out of pocket. They expressed feeling that people had become numb during the quarantine period. Chikungunya fever is an acute mosquito-borne infectious disease caused by the chikungunya virus. After an infected mosquito bites a person, the virus reproduces inside the mosquito. When the mosquito bites another healthy person, the virus is transmitted. The incubation period for the virus in humans is typically 1 to 12 days, with 3 to 7 days being the most common. The symptoms of chikungunya fever are similar to those of dengue fever. Most patients experience mild symptoms, including fever, joint pain, muscle pain, headaches, fatigue, and rashes. Recovery usually occurs within 1 to 2 weeks. While most patients fully recover, complications affecting the eyes, heart, and nervous system can occasionally occur. Elderly individuals, particularly those with underlying health conditions, as well as newborns born to infected mothers or those bitten by virus-carrying mosquitoes during their first few weeks, are at higher risk of severe symptoms and even death. On August 1st, a vlogger advised people not to visit Foshan unless necessary. I just got back. At the entrance of the village where I live, people are checking and spraying mosquito repellent. It's reached this point, which clearly shows that it's really serious. If you're planning to visit Foshan, I suggest you don't. There's nothing much to do here anyway. Shunde and other places like Shenzhen have more to offer. When you go out, wear long sleeves and pants, and make sure to spray some mosquito repellent. You know what? Right now, I'm at home, and I've even installed mesh screens. I've also put screens on the balcony doors. Now, I'm always paranoid. Sometimes when I get bitten by a mosquito, I get really scared it might be from that virus. Dr. Wen Shui-chun, head of the Respiratory Infectious Diseases Department at Shunde District's Third People's Hospital, stated that about 90% of chikungunya patients experience fever, and nearly 80% have joint pain. The World Health Organization explains that joint pain caused by chikungunya fever can make patients feel weak. It lasts for a few days, but it can also go on for weeks, months, or even years. On July 27th, a netizen from Foshan posted a video stating that he suspected he was one of the first locals to contract chikungunya fever. He recalled that he first showed symptoms around July 1st, starting with diarrhea, joint pain, and a mild fever. At first, he didn't realize he had a fever, feeling only uncomfortable. It wasn't until he went to the community clinic that the doctor checked his forehead and told him he had a slight fever. The doctor immediately arranged a blood test and prescribed symptomatic medication. At the beginning, his symptoms were just a mild fever and significant joint pain, mainly in places where he had previous injuries, like his fingers, knees, and ankles. The pain was so intense that it was difficult for him to go up and down stairs. By July 5th, as other symptoms began to subside, he noticed small red rashes appearing on his body. These rashes were tiny, like sesame seeds, densely covering his body, especially on his back, which was very itchy. It took about a week to 10 days for them to completely heal. On August 1st, another vlogger shared their experience. On the 5th day of chikungunya, my joints no longer hurt, and I've developed many rashes on my body. These are signs that I'm getting better. Tomorrow, I'll have another blood test, hoping for good results. Another vlogger shared their symptoms.
First, it's joint pain. 3 or 4 days ago, I felt pain in my joints and my fingers, especially the thumb, for no reason. It wasn't from any injury, it just hurt on its own. After 3 or 4 days, I started to get rashes on my body, but they didn't itch. Then, I had a fever, suddenly spiking to 39 to 40 degrees Celsius. My body temperature was over 39 degrees. Now it's 1:22 a.m., and the indoor temperature is about 30 degrees. When I first had a fever, I felt very cold. A few days ago, I had to turn on the air conditioning, but now, I'm under a blanket, still feeling cold. My mom said my eyes were very red, with bloodshot veins. There's no specific treatment for this condition. You just have to tough it out.
On July 28th, a vlogger who had previously contracted the virus reported that after 11 days, their condition had improved. They hadn't had a fever for the past couple of days, but still had some lingering head pain, which was expected to last for about 5 more days. A netizen asked which was worse, COVID-19 or chikungunya. The vlogger replied, "I feel like this is a bit worse." Another video showed people waiting for their blood tests for chikungunya fever, with many waiting for several hours until the results were available. Some people were specifically sent to disinfect markets, and a netizen commented, "Here it comes again, the same familiar scene." On July 31st, the authorities in Foshan announced a 7-day adult mosquito eradication campaign to control the spread of chikungunya fever. In Foshan, mosquito eradication efforts were being carried out across communities. Other videos showed large groups of armed police in Foshan carrying out mosquito control. In these videos, epidemic control workers were spraying fogging chemicals on trees. Factories had workers lining up to have their temperatures taken, and mosquito nets were even installed over drains. In Zhongshan, Guangdong, retail pharmacies in Sanxiang town began registering information on people buying antipyretic medicines. On August 1st, a nurse from Guangdong posted a message saying chikungunya fever is back, but this time don't expect me to rush forward like I did before. Whoever wants to take the burden, let them take it. The epidemic has already begun to affect the normal functioning of society. On July 31st, netizens revealed that some middle schools in Zhuhai, Guangdong had delayed the start of school due to the outbreak. The CCP's Center for Disease Control recently stated that chikungunya fever is preventable and controllable, primarily spread through mosquito bites from Aedes mosquitoes, and there's no evidence of human-to-human transmission. However, on July 27th, China's renowned academic control expert Zhang Wenhong argued that humans are actually a source of transmission, helping to spread the virus by passing it from human to mosquito and then from mosquito to human. The virus can be carried by people to new mosquito habitats, further spreading the disease. On July 31st, China's National Health Commission released the 2025 guidelines for chikungunya, highlighting that the virus can be transmitted from mother to child, and in rare cases through blood transfusions or contact with infected blood. Currently, there is no available vaccine for chikungunya in China, and there's no specific antiviral treatment. The approach is to focus on symptomatic and supportive treatment, avoid using aspirin, refrain from unnecessary use of antibiotics, steroids, or immunoglobulin. One blogger expressed concerns about the virus potentially mutating in China.
爆发得太快了。
The outbreak is spreading too quickly. More than 5,000 cases of chikungunya fever have been found in Guangdong, and other provinces are seeing a rise as well. What worries me the most is that it might mutate, as it's a single-stranded RNA virus. I'm not scaring you, but do you remember COVID-19? It's another single-stranded RNA virus, and the reason COVID-19 was so dangerous was because its mutating ability, something we've all experienced. Chikungunya fever is not just transmitted by mosquitoes, it can also spread through birds, bats, and other animals. Everyone needs to take proper precautions, avoid places with standing water, minimize contact with animals, and be sure to prevent mosquitoes.
Chikungunya fever was first discovered in Tanzania in 1952. 20 years ago, it had a major outbreak on Reunion Island in the Indian Ocean, and over 100 countries have reported this disease. However, 20 years later, it has made a comeback, and this time it began in China. It's worth noting that the severe chikungunya virus outbreak in Guangdong has led some netizens to speculate that there may be unusual reasons behind it. One netizen pointed out that in May of last year, Shi Zhengli, a researcher from the Wuhan Institute of Virology, the one who was implicated in the origins of the COVID-19 virus, joined the Guangzhou laboratory. Shi Zhengli is currently affiliated with the Guangzhou laboratory and the Wuhan Institute of Virology. This netizen speculated that Shi Zhengli, who is known for researching venomous bats and various toxic organisms, may be related to the current outbreak of poisonous mosquitoes. Could China have a different strain of the chikungunya virus? And is it possible that it has mutated? The government's mosquito control efforts have been criticized and ridiculed by the public.
To prevent mosquitoes that spread chikungunya fever, the entire farmland was cleared. All the crops were removed cleanly.
Another video shows the local government deploying over 100 people to remove dozens of flower pots from apartment rooftops. I had banana trees that were all chopped down, cut to pieces. Basically, they just cut down my fruit trees. One blogger criticized the local epidemic prevention efforts as mere formalities. Aren't they trying to prevent chikungunya fever? Look at this water at the entrance. They splashed some outside, but it's not even enough to form standing water. It's formalism at its finest. It would probably dry up in 30 minutes on the main road, and yet they're doing this. A blogger expressed frustration over the use of sudden, aggressive measures to solve problems. Why is it that every time the solution is always a surprise action? It's like they want to make sure everyone knows about it. The idea that standing water breeds mosquitoes is common knowledge, and private spaces usually pay close attention to that. So why is standing water in public spaces allowed to persist for so long? For a long time, the public areas in our neighborhood had a lot of mosquitoes because there were many plants and water sources, and the area sees a lot of rain and typhoons in the summer. My property management fees aren't much, and I assumed this was just an unsolvable problem. But last month, when I saw workers in Japan, I realized my understanding was wrong. In real life, there aren't so many objective difficulties. Sometimes it's just a lack of action or poor decision-making. While we think it's normal to have standing water, others are actively trying to solve the problem. Now, because of chikungunya fever, we're all having these surprise actions. I absolutely believe that with successful experience, there's nothing we can't overcome. But the problem is, nature doesn't follow our lead, and we're not the only ones in charge. If we don't turn these surprise actions into long-term routine tasks, we might send chikungunya fever away, but next time it mutates, how many times can we do this? Some neighborhood committees have also been forcefully entering residents' homes to inspect. On July 28th, a resident from Foshan, Guangdong, posted on the Xiaohongshu platform, saying that the neighborhood committee in Sanshui district was inspecting for chikungunya fever and checking for standing water and mosquito control. With no one at home, the property company directly forced open the door and entered. On July 25th, Foshan's Guicheng district punished tenants in rental properties who refused to cooperate with home inspections by cutting off their power supply. Netizens commented, "This seems illegal," and "It's back again, those 3 years are back again." The 3 years refers to the period from 2020 to 2022, during the large-scale outbreak of COVID-19. Then, the CCP implemented extreme lockdown measures that disregarded the basic survival rights of citizens. Measures included sealing doors, forcing entry, and mandatory quarantines, leading to numerous humanitarian and secondary disasters. On July 29th, Fuzhou's Disease Control Center issued a statement that individuals coming from high-risk areas, like Foshan, and foreign epidemic areas would need to undergo 14 days of self-health monitoring. If they showed symptoms like fever, joint pain, or rashes during this period, they were advised to seek medical attention and inform authorities about their travel history. Travel restrictions are coming back. Online reports suggest that some districts in Zhuhai, Guangdong have begun checking for individuals with a history of travel to Foshan. Some hotels in other cities have also started to refuse guests from Foshan. The CCP authorities are using various campaigns to strengthen social control and reinforce the public's obedience. This characteristic of autocratic regimes has never changed. However, this approach is having an impact on China's economy. On July 27th, a blogger shared a video saying,
These days, every time I open my phone, my screen is full of news about chikungunya fever and Shende. After seeing it for a while, it really makes me anxious. It feels like we're back to 5 years ago during the pandemic. The streets are less crowded, shops are empty, and no one dares to go out casually. But honestly, this chikungunya fever is not as scary as it seems. What's really worrying is the current situation for brick-and-mortar stores. Business has been getting harder year after year. Originally, we were hoping for a summer boost, but now 3 major food delivery platforms have started offering $0 purchases. If you subsidize 10 yuan, I'll subsidize 20, making people accustomed to ordering food at home instead of going out to shops. Who'd want to go to a store now? This week, I've barely made 500 yuan in sales. If this continues, I won't even be able to pay the rent or utilities. It's really tough. Business was already difficult, and now it's even worse.
今年做餐飲真係難到 Q 咁啊！
This year, running a restaurant is so difficult that I want to cry. You have no idea. After going through the intense competition with billions in subsidies, prices are now pushed so low that there's barely any room to breathe. Now we're hit with the chikungunya virus. There's almost no business around, especially in Shunda, where restaurants are everywhere. Every day I'm thinking, how much will I lose today? And how much will I have to pay in staff costs? China's rising epidemic situation has also attracted international attention. In addition to the World Health Organization warning that chikungunya could spread globally, the U.S. Centers for Disease Control has announced that with the increase in chikungunya fever cases in China, the U.S. plans to issue a travel advisory. The situation is currently under evaluation.